Experience acute knee pain, non-traumatic knee pain is what I'm referring to, so not related to like a traumatic injury, a fall, a sports injury, anything like that from time to time, especially as we age. So I want to demonstrate a few of my favorite exercises to address that acute knee pain. And this is more of kind of calming it down or dealing with it. You know, even from a prevention standpoint, you can do some of these exercises as your warm up before you do a lower body workout. They're great exercises for kind of isolating load on the knee, loading the knee in a way that kind of helps build it back up and help calm down the pain and irritation. So the first one is called a terminal knee extension. So you're going to take a band, you're going to put it behind the knee. You want a good bit of tension. Obviously you can step forward or back to increase the tension. You can use smaller or bigger bands. But you want a fair amount of tension here with this, and you want to build up with it as well. What you're going to do is you're going to let that knee bend, roll up on the toe. You're going to drive back, trying to tighten that quad and hold. So trying to stay nice and tall. Here. Driving through the heel, driving that quad tight and hold. I like starting with 10 count holds. You can work up to 20 count holds, so this is a little bit more of an isometric hold here. You can do some just working through the motion as well. So you can kind of go 10 back and forth if it's a little sore, just moving it. And then start to, maybe do a set of moving it. And then a set of longer, 5 to 10, let's say 20-second holds, five reps, 20-second holds to finish with. So that's the first one. The second one we're going to look at is an isometric lunge, okay? Or split squat. So simply here, we're just going to go into a comfortable range. We're going to hold here. So staying nice and tall, chest up, loading that knee a little forward over the toe. All this is based on tolerance. You can drop down lower if you can tolerate it. You can try to drive that knee more forward if you can tolerate it to load the knee a little better. Again, if you're hurting, pain is going to drive this. We're holding, again, maybe 20-second hold, 30-second hold, 45 reps. You can load this heavy with weight as you build up. Also a great way to work into prehab or maintenance injury reduction type stuff into your workouts is adding some isometrics in that. But we want to load that knee, so the key here is letting that knee drive forward. Nothing wrong with letting the knee go past the toes here, and then holding there. Okay, body weight's a pretty good challenge. You can start to add some weight to that. Again, about 5 sets of 30 seconds. Another isometric I like to do is seated knee extension. So any kind of immovable object, you're just gonna push into it. Okay, you can do a wall, box, anything's not gonna move. So you can play with the different ranges. So you can start at 90, and come out to more 60, even maybe out to 45, just kind of working some different angles of flexion. Same thing, 20-second holds, 5 seconds, you're going to control the pressure, so you're pushing as hard as you can tolerate. And again, these are exercises that there is some strengthening aspect to this, but the goal here is to kind of load the knee in a more controlled fashion through a controlled range of motion to calm things down. And then we can progress through more full range of motions exercises like squats, lunges, step ups, those type of things. Again, these can be beneficial when we're hurting acutely. These can be beneficial as part of a warm up, or if you're someone that deals with maybe some chronic knee pain, things to do consistently. So give those a try. In terminal knee extensions with the band, set of 10 moving, and then 5 sets of 20-second holds. Isometric lunges, 5 sets of 20-second holds. Isometric knee extension.